Talk about Medicare prior authorizations for Medicare Advantage plans and Medicare itself, the new changes for the big, beautiful bill, Dr. Oz recommendations, the new announcement on prior authorizations. Prior authorizations are basically, hey, the doctor says I need this, and the doctor and you have to ask the Medicare Advantage company whether you can do X, Y, and Z. Medicare has prior authorizations too, but very, 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 very limited. And we are lucky enough to have Ari from Chapter here today to answer your questions. Everybody's always excited to see Ari. And so thank you, Ari, for joining us.
Thank you so much for having me, Dr. Ed. It's a pleasure to be with you and our viewers.
All right, so let's see here. And this is also a live Q&A, and we got a lot of people, a bunch of questions already. Since we're going to focus on Medicare today, I'll throw in a regular Social Security questions. A bunch of people have Social Security questions, but we'll try to stay focused on Medicare today, because there's so much going on. The prior authorizations, the Medicaid, the Medicare Savings Program. A lot of people worried what's going to happen with those. All right, Ari, so what are prior authorizations and what changes recently were announced, and how does that affect people out there?
Let's start with the definition. Prior authorization means that you need approval from your insurance company before you can get the desired care or benefit that you're seeking. So it means you need the insurance company's permission. As Dr. Ed mentioned, it is not a very large portion of original Medicare. If you have original Medicare, you can get anything that's medically necessary, which is at your doctor's discretion. On the flip side, though, if you replace original Medicare with a Medicare Advantage plan, then you are subject to prior authorization. Virtually all Medicare Advantage plans are subject to prior authorization. And in 2023 alone, there were over 50 million prior authorization requests from people who were on these types of Medicare Advantage plans. So it is a big thorn in the side of people who are on Advantage plans. Two camps here. If you're on original Medicare and you have a Medigap plan, I know Dr. Ed recommends Medigap Plan N, you really don't need to worry about prior authorization. On the other hand, if you have replaced original Medicare with a Medicare Advantage plan, then the next 10 to 15 minutes of content is for you.
Exactly. So when we're talking about prior authorization, so this isn't like a second opinion where you go to a doctor and the doctor says, "Oh yeah, you need a hip replacement," and then you're going to another doctor to get a second opinion. It's not like that, right? It's just does an actual doctor at the Medicare Advantage plan review this? Supposed to review this? What's this? I hear about AI.
The insurance companies, so the Medicare Advantage insurers, have care management teams. And oftentimes it does end up going to a doctor to decide whether your doctor has made a correct determination and you actually need that hip replacement or not. Sometimes the requests aren't even reviewed by a doctor, though. As Dr. Ed mentioned, increasingly, these insurance companies are using artificial intelligence to determine the merits of your request in the first place. And then only if you appeal it does it go to a doctor to review. But the Advantage plans have doctors on staff who can review these requests and your appeal.
Okay, so if they approve it, and hopefully they approve it, and hopefully they approve it timely, then it goes back to the doctor, and the doctor can get what they need to get done. If it's not, what type of appeal procedures do they have?
Yeah, so first and foremost, of the 50 million prior authorization claims that were made in 2023, many of them were approved, and they were approved rapidly. They were approved within 24 hours. So what Dr. Ed is asking, what if your prior authorization claim was not approved? What are your options? Well, here at Chapter, we're going to help you appeal. And if your doctor made good notes in your file as to why you need a hip or a knee replacement or something else, then we're going to be able to craft a strong appeal on your behalf to see if we can get that prior authorization request approved. The appeals procedures vary by insurance companies, but they're required to have them. So each Advantage insurer has slightly different appeal forms. So that's if your prior authorization request isn't approved. The appeals process can vary slightly carrier by carrier, but here at Chapter, we're familiar with all of them. And we keep notes on each carrier to figure out exactly which department is going to handle them. So then we can fight the good fight on your behalf. And then we can get into appeals to the appeal. And it makes my head spin, even as a practice, even having gone to law school, right, and knowing the appellate process.
Right.
It's just as complicated going through the prior authorization appeals process. So it really helps to have an advocate on your side.
Yeah. And the key is to fight it. If your
The key
doctor
is to fight it.
says, yeah, because it just with anything, Social Security, Medicare Advantage plans, or whatever the case may be, disability. Yeah, if you fight it, if you speak up and you do the reconsideration and do the administrative law judge, all that stuff, then absolutely, there's always usually a very good chance of them overturning. And I'm putting up my website. It's the mygovexpert.com website. It's a free website. Anybody can use it. It's all thing retirement, disability, survivor benefits, and everything. But if you click on the more and click on appeals, it talks about appeals process, and it talks about appeals in terms of Social Security, original Medicare, but also about halfway down, it gets into Medicare Advantage appeals. And there's several stages: level 1, level 2, level 3, and 4, federal court. And then again, as Ari points out, each company has a little bit different. They're supposed to kind of stay within the federally mandated parameters, but they're able to change it around a little bit. And you can appeal not only, a hip surgery or something, but if they say, no, you can only take this type of drug, that is a formulary exception. What is a tiering exception? You want to explain what a tiering exception is?
Sure. So what Dr. Ed is now getting into is Medicare Advantage companies impose prior authorization requirements on your hospital and medical benefits. Separately, Medicare Part D has cost containment techniques. One of them is a tiering exception. So let's say you're on an expensive brand name medication, and there are many of them. So I'll just pick, let's pick one for someone who's fighting cancer, Keytruda. Keytruda, under many prescription drug plans, is a tier 4 or tier 5 medication. That is one of the most expensive tiers. You can instead have a tiering exception to have the medication reduced to perhaps a tier 3 brand name medication, brand name preferred, which would be at a lower price than what you would have paid. What you can also get is, let's say you're on a prescription drug plan and you need Keytruda to fight your cancer diagnosis, but it's not on your Medicare Part D formulary. It's not on the drug list for your specific Medicare prescription drug plan. We can get a tiering exception to have it included, and that way you'll be able to take that life-saving cancer medication. And there are numerous medications just like Keytruda. And really, this tends to apply to someone who's fighting a pretty serious or a rare illness.
Yeah, I've had people that there's 3 or 4 different types of medication. They're all basically the same, ingredients and everything. But some people say, well, for whatever reason, psychological reasons or habit or whatever the case may be, this particular brand, it doesn't upset my stomach or whatever the case may be, whatever the issue was. And I said, well, fight it. And they fought it. And even though that particular brand wasn't on the formulary, the company was able to add that particular one. But a lot of people just don't know that they can ask for an exception on pretty much anything. And if the company says no, then you just, see if you can fight it.
Yeah, in the fall, we were helping a member who lives in Northern California. They have a rare form of muscular dystrophy, and they're on a prescription that allows them to almost lead a normal life, but it's 6 figures per year.
Wow.
And there was no drug plan in Northern California that covered the medication that they needed. So we were able to help them obtain an exception in order to get that medication covered for this year. And
Awesome.
it saved them $90,000+.
Wow. Holy cow. You guys are awesome like that. And remember, and our community is awesome like that because all the people out there, well, this doesn't apply to me. I'm sure there's somebody around you that it applies to. And if you don't know whether it applies to someone, then just press like, subscribe, share. And then it just might happen to pop in somebody's, feed one day and they're like, oh my gosh, I can save $90,000. I already just said I can save $90,000. Well, let me go ahead and try that. So you might change somebody's life by just pushing the like button and save button. That's how we teach this stupid computer algorithm that this is important stuff. So there's that.
On average, just by taking 15 minutes to review your prescriptions in the fall, you can save $1,100. Now that's the average savings, but that's
Wow.
why it's so important to review your prescriptions every year. So even if you're on a Medigap plan, remember, we always talk about this when I'm on. Marry your Medigap, date your drug plan. The time for dating is the fall for your prescription drug plan. That is also true for your Medicare Advantage plan. You want to shop your Medicare Advantage plan every fall to make sure it's optimal for the upcoming year.
Speaking of that, because there's all kinds of special enrollment periods with a Medigap, a Medicare supplement, a Plan G or F or N or whatever the case may be. You can actually change. You have the potential to change that any day of the year. You might have to go through health underwriting depending on your particular company, your particular state, which is not a physical or anything. Ari and his team just ask you a bunch of questions. But a Medicare Advantage plan, normally people can only change that from October 15th to December 7th, but there's a lot of exceptions there. And one of the exceptions that a lot of people are asking about is all the craziness with Medicaid. So let's talk about that. But before we move on to Medicaid, and then before we move on to our live Q&A, because I've got lots of questions, what's going on with the Dr. Oz announcement of Medicare insurance, Medicare Advantage companies promising to reduce prior authorization? Weren't they mandated? Was it that a regulation that was passed and now it turned to a promise or something?
The regulations are just being finalized for 2026, and we won't see where the rubber will meet the road when the plans are released for 2026. And that'll happen sometime in early October. As Dr. Ed mentioned, the Medicare open enrollment period, the Medicare annual enrollment period, is from October 15th to December 7th. So we don't have those plan information details yet for 2026. That said, if you have a special circumstance, let's say you're moving, if you're moving, you get to shop your plan now and you can change it for the remainder of the year. Now, as for the prior authorization regulation, there were proposals under the Biden administration to reduce the number of prior authorization claims. So remember, in 2023, over 50 million prior authorization claims were submitted on Medicare Advantage plans. So there were regulations that were designed to tackle that number and to reduce it. As for whether it's become policy or a promise, we'll see. It's still early days in this administration, right? Dr. Oz has only been head of the Center for Medicare and Medicaid Services for a few months.
And one more thing, we were talking before we started about there was supposed to be that utilization letter that was supposed to be going out in July, and I've been talking to my community, our audience about that. And has anybody received the letter? And nobody's received that letter. They were supposed to be going out mid-year, but it looks as though that has been pulled back as well, right?
So the benefit utilization letter that Dr. Ed is referring to, it was supposed to cover how you were utilizing the extra benefits offered by your Medicare Advantage plan. So many people choose a Medicare Advantage plan in order to get a little more over-the-counter benefits so that it can cover first aid supplies and vitamins, for example. What that benefit utilization letter was supposed to say is, you signed up for a plan that has a $100 quarterly benefit. And we noticed that over the past 6 months, you've used zero of your allotted OTC benefit. As far as I'm aware, I haven't heard of someone receiving that benefit utilization letter. If one of your viewers has received it, please reach out to Dr. Ed. Send that letter to Dr. Ed. We'd love to cover it in our next Q&A.
Yeah. I've talked about that several times and nobody's received that letter yet. So, but that doesn't matter for y'all. because you're always on top of it. You reach out to your Medicare Advantage plan and say, or the person that signed you up, or if your chapter signed you up, reach out to Ari and his team and say, hey, as Ari always says, you pick your plan based on the 3 Ps, right?
The 3 Ps, not based on how much over-the-counter benefit you get, but instead based on, number one, your providers, the doctors that you see, the doctors that you would want to see if you developed a chronic condition, or the institutions that you'd want to go to. Mayo Clinic, Cleveland Clinic, Sloan Kettering, the list goes on. Number two, your prescriptions. What medications do you take? What pharmacy do you like to go to? That has a huge impact on price as well. And then the third and final P, your priorities. If you like to travel like Dr. Ed, you'll probably be better served by a Medigap plan than a Medicare Advantage plan.
Okay, so you look at those 3 Ps, and then after you focus on those, then you look at all the bells and whistles and the free ice cream and unicorns and all the rest of it. But if you did sign up for a plan and it did have those free unicorns and ice cream, then you need to find out about it and get it because you paid for it. You're like, no, I didn't pay for it. It's zero premium. No, you paid for it when you paid all those taxes, all those decades. So reach out to either the person that signed you up, reach out to the Medicare Advantage plan, reach out to chapter if they signed you up, and they'll say, oh yeah, no, you've got $3,000 of dental. Did you use any dental this year? Well, you definitely got to use dental. So yeah, make sure you get it. All right, let's
Dr. Ed, you're in the comments, we have Michael received a letter. Lisa said that she's receiving a letter today. This is great. Please send those letters to Dr. Ed. He will forward them along. And if you're already a chapter member, let's see how we can get more out of your plan for the upcoming year. Just reach out to our team and we'll see what benefits you're underutilizing.
Okay, so yeah, this is the first time I've heard someone get a letter. So yeah, so send me ed@mygovexpert.com. Just fold it or tear off your name and address and stuff like that. Any PII, your personal identified information, and just the picture of the text of the letter, because yeah, we haven't seen it yet, and it looks like somebody's actually got some. So this is awesome. Let's go get through a couple of questions. Diane, in the past week, I have received 3 phone calls regarding Medicare prior authorization for prescriptions submitted by my doctor after recent hospitalization. Start date of this policy.
So to Diane's question, we would need to know when her plan started. If her plan started already, then let's figure out how we can get those prior authorization requests approved lickety split so that you can get the medications that you need. If they were the result of a hospitalization, then obviously you need those medications, and we want to make sure that they're covered affordably.
Yeah, phone calls are directly, so they reach out to probably the Medicare Advantage plan reaching out to them, or the hospital saying, hey, we gave you these prescriptions in the hospital and your company is having an issue with it. So in situations like that, usually people are kind of stuck in the middle, where they have the doctor, they go get their things done. And then they have the health insurance company, whether it's a Medicare Advantage or Affordable Care Act or private health insurance, whatever the case may be. So they go do their thing, and then for some reason the health insurance company decides not to pay, or it's slow, or whatever the case may be, and then the doctor reaches out to you and says, hey, we didn't get paid by the health insurance company the $5,000, so we're going to bill you. And sometimes it's just a function of, okay, you need to reach out, and the doctor says, well, our staff already reached out 3 times. And so what do people do like that when they're kind of stuck in the middle?
This happens all the time. So sometimes you get a bill for $600 from a care provider, and it actually was illegal for them to charge you because they didn't first go to your insurance plan. First, they need to go to your insurance plan. And if they don't follow the rules and procedures outlined in the terms and conditions of your plan, then they're going to have to eat that bill. That's something that many people don't realize. And again, it's something that our advocate team is expert on. You don't have to call the insurance company in order to decipher these hieroglyphics. You just call the chapter member advocate team and we get to the bottom of it on your behalf.
Yeah. Okay, so let's see. Get some other questions. What about everything? The big beautiful bill, as they call it, Medicaid. So we're talking close to $1 trillion cut out of Medicaid. And that's going to have a trickle down effect. Not only the people on Medicaid, but rural hospitals are going to have. There's some that was it the governor of Pennsylvania was on, and he was saying that there's hundreds of hospitals throughout Pennsylvania that are they're already below water, and 50% of the money they get coming in are coming from Medicaid patients. And if you know get rid of 10, 15, 20,000 of those patients who are no longer able to pay their bills, then you're going to see rural hospitals throughout the country just shutter, or sometimes even worse, they're taken over by private equity that's just looking for a quick buck, and they kind of ruin service and before they sell it off to whatever. So I've talked about
So
this a few times. It's kind of a sore spot, but anyway. So Medicaid, what's going on with the world of Medicaid?
there are substantial cuts to Medicaid in the big beautiful bill that was signed into law on July 4th. That said, there is a component to the big beautiful bill called the Rural Health Transformation Program. It's a $50 billion fund in order to support these rural hospitals. We'll see how the funds are distributed and if that helps prevent these rural hospitals from shuttering.
Yeah, yeah. It was interesting. The politician said, "Oh yeah, this is not going to affect rural hospitals. Yeah, you're just Chicken Little and yada yada yada." But then all of a sudden, at the last minute, they realize, "Oh, okay, well, wait a second," and then they decided to put in this kind of slush fund there.
Right.
I just
There is a $50 billion slush fund for rural hospitals. We'll see if that keeps them from closing, though.
Yeah, yeah, yeah. Megan asks, I just read in the newspaper that my hospital and doctors are going to be getting hit hard. I live in a small town about 90 miles south of Buffalo, New York, and I am on disability because I have epilepsy. Yeah, so you need to reach out to your state politicians. And a lot of states that said they just can't, cover that gap. If they're going to have, billions of dollars less coming in for the federal government, there's a lot of states out there that just don't have, that type of budget to cover that deficit. And who is going to be in charge of that $50 billion? It's going to be, what type of states will it go to?
Yeah.
It's
At the heart of Megan's question is so many doctors accept Medicare and Medicaid. These are two separate programs, by the way. Medicare is typically for people who are 65 and up, and also for people who are younger than 65 and qualify by way of Social Security disability, means you've been receiving cash disability benefits for 2 years, or you have end-stage renal disease or ALS, Lou Gehrig's disease. The other program is Medicaid. Medicaid is for the low income, and you can actually have Medicare and Medicaid, but the cuts that were in the big beautiful bill were to Medicaid, not Medicare.
Someone said they watched your video explaining the chapter video explaining the process, and so happy to see you here. Says
Thank you.
Nona Dona.
Oh,
Yeah,
Nona,
but
don't. Thank you, Nona.
yeah. So yeah, so the I talked about this in a previous video, but there are actual cuts to Medicare. It's not in the bill, the reconciliation bill, but anytime Congress passes anything like this, or this particular reconciliation bill that causes a deficit, it automatically triggers, and there was no exception made, it automatically triggers the Pay As You Go Act of 2010. Well, it says, okay, you caused a deficit, you have to find money other places. And Social Security Administration is exempt from those cuts. The Veterans Affairs is exempt. The next target of the biggest is Medicare. So they're estimating about $500 billion cutting from Medicare. So next year, I think it's my guesstimate that these prescription drug plans and Medicare Advantage plans, they've got their accountants in a room trying to figure out how they're going to make money next year and redesign their Medicare Advantage plans, prescription drug plans for 2026. So we definitely have to. You're going to be busy, Ari. You and your team are going to be really, really busy.
Yes, this year more than ever, there will likely be massive changes to the plan offerings for 2026 on the Medicare
Yeah.
Advantage side. And also, I wouldn't be surprised if there are large changes to Medicare Part D as well.
Yeah. And people are going to say, Ed, you said the same thing last year. And yes, and because that's when the Part D, it went from, what was it, $8,000 to $2,000 max out of pocket. So the insurance companies were redesigning everything. So that was a humongous change that the Medicare, insurance companies had to account for to make sure they made their profits. So I was right at that time, and so that's the old thing, hold my beer. It's going to be even crazier this year, I think.
We do know that the cap on Medicare Part D will remain, and the out-of-pocket cap on your Medicare Part D, your drugs, your prescription benefit, will be $2,100 for 2026.
Yeah. And I think they're doing I just read they're going to make that smoothing a default,
Yes.
the prescription drug payment plan. Explain
Yes.
that.
So in 2025, the Medicare prescription payment plan operated on an opt-in basis. So you enrolled in your Advantage plan or your Medicare Part D plan, and it's one or the other, by the way. You can't be on a Medicare Advantage plan and a Part D plan. It's one or the other. And then if you were on expensive prescriptions and you wanted to smooth out the costs over the course of the year, you separately needed to opt in to the program, to the smoothing program. For the upcoming year, it's going to be automatic. So if you're on expensive prescriptions, you're going to be opted in automatically. And that will allow you, rather than paying $2K at the beginning of the year, it'll allow you to smooth out that $2K over the course of the year if your prescription is covered by the Advantage or Medicare Part D plan of your choosing. So that is where the rubber meets the road. Remember, all your prescriptions must be covered under the plan that you're choosing, or you need one of those formulary exceptions that Dr. Ed and I were talking about.
Perfect. Okay. Yeah, a lot of people didn't realize that whole smoothing things. Kelly asks, are they cutting Medicaid for people that have Medicare? Are they getting Medicare as well? Well, again, a lot of the Medicaid changes in that the bill won't take place. Politicians are politicians. It doesn't matter who they are, until after the elections. The midterm elections, but a lot of states we've already seen they're kind of doing a preemptive strike where the states, just like Medicare insurance companies, are saying, well, here's what the forecast looks like for next year and the year beyond. Let's start making some changes now. So I'm seeing some states that are saying they're going to start cutting back on Medicaid. They're going to start, maybe raising the percentage of the federal poverty rate that you're eligible for, and there's going to be a lot of changes. Does that in and of itself affect Medicare? No. But remember, Medicaid, it has several levels. There's QMB and SlimB and QI, and there's all kinds of different levels of Medicaid. If you're in the higher levels, those are the Medicare Savings Program where they pay for your Part B premium, the $185. So you could still have Medicaid. You're like, oh, I'll still have Medicaid. But the state, because of budget constraints, they might downgrade you and save that $185. And guess who has to pay that $185? You do. So that's possibly what we're going to see going forward. Do you agree, Ari?
Potentially.
Yeah. So we're not 100% for sure. We're keeping an eye on this, but yeah, if you get downgraded Medicaid, then you have to pay the $185 yourself. And then if you're downgraded in Medicaid, you're no longer able to get a Medicare Advantage dual eligible plan then, right?
Well, people might be confused where that $185 number is coming from. That's the standard Medicare Part B premium for 2025. Most Americans, over 85% of Americans, pay $185 per month for their Medicare Part B. So what Dr. Ed is saying is if you lose your Medicaid and your Medicaid was subsidizing that $185, that is, it was covering the standard Part B premium, then when you lose Medicaid, you're going to owe that $185 per month, and it'll either be deducted automatically from your Social Security, or the government will send you a quarterly invoice for it. And that can be a huge pain to people who are living just off their Social Security if they now owe that $185
Yeah.
per month.
And not if they lose Medicaid. If they could still have Medicaid, cost sharing Medicaid, because there's different levels. If you lose your higher levels of Medicaid, then you just might lose that $185. And if you lose Medicaid or the higher levels of Medicaid, then you could also lose your grocery card, that over-the-counter card, another $100, $200, because you're no longer eligible for a Medicare Advantage dual eligible plan. Correct?
Correct.
Yeah.
Now, if you lose your Medicaid, there's by way of redetermination, there's an appeals process. So please, if you're losing your Medicaid and you have Medicare, then we can try to help you reestablish your Medicaid. The rules vary state by state because Medicaid is a block grant program, meaning the states administer it, and it goes by different names in different states. In Alaska, it's Denali Care. Here in Arizona, it's called Access. And in Wisconsin, it's called Badger Care. So it really depends on the state that you live in. But if you have been redetermined for Medicaid and you're losing that benefit, then there is an appeal process to try to help you reestablish it. And sometimes it can be as simple as updating your address if you've recently moved.
Yep. Okay, so I've got my website up there again. So the appeal, reconsideration period, and all the rest of it. So it gets into some of the full dual eligibility, QMB, SLIMB, QI program, how they work together in terms of Medicare, Medicaid. So definitely check out the website on that one. You just click under more and you click on their Medicaid and it has, am I eligible, how to apply, keeping coverage, the latest updates. So definitely check that out. Or if you're, reach out to Chapter. And if you lose your Medicaid or downgrade it in your Medicaid, then if you lose that particular Medicare Advantage plan, then you do have a special enrollment that you don't have to wait till October. So if you gain Medicare, gain Medicaid, lose Medicaid, move, what other kind of things where you can change your Medicare Advantage plan?
There are so many exceptions that might allow you to change your Medicare Advantage plan mid-year. You mentioned a few of them. One, losing Medicaid. Of course, you get the opportunity to then shop for a regular old Medicare Advantage plan. Another would be if you have Part D extra help, which we haven't talked about yet. But even if you don't qualify for Medicaid, you might qualify for Part D extra help. And so if you qualify for Part D extra help, that would also allow you the opportunity to reshop your plan. And Part D extra help is a great program. Again, it's separate from Medicaid. If you do get Medicaid, then you're automatically placed into the Part D extra help program. But even if you earn too much to qualify for Medicaid, you can still qualify for Part D extra help. You apply through the Social Security Administration, and it can help you save upwards of $5,000 per year. So we talk about Part D extra help in every Q&A that we do together. And I just want to note that here in case someone is having trouble paying for their prescriptions.
Exactly. And it's one of the easiest applications. I've done millions of those particular applications. And yeah, they're the easiest application at Social Security to do. Dari asks, does prior authorization on dental coverage provided through a Medicare Advantage plan qualify as part of the conversation? Everything qualifies as part of the conversation.
For sure.
Or are you just discussing? Yes. So prior authorization for dental coverage, is there such a thing?
There are terms and conditions as to how you can use your dental coverage. So the first thing is dental coverage is usually subject to network constraints. So we want to make sure that that dentist you have a long-standing relationship with would be one of the providers that's covered under the dentistry benefit offered by your Medicare Advantage plan. Then the next question is, well, what type of dental procedure do you need? There's oftentimes carve-outs for bridges, crowns, dentures. And we want to make sure that if you need that type of dental work, that it would be covered under the plan that you're choosing.
Perfect. Perfect. And what is the monthly premium for Chapter?
There's no cost to use our services. There was another question that asked, how do we keep the lights on? We earn revenue from insurance companies, and it doesn't matter which insurance company you choose. The vast majority of insurance companies pay us a commission. That is, when you enroll in the plan, we earn some revenue from the insurance company as a result. It does not matter to us, though, if we earn revenue from the insurance company or not. Our North Star is finding you the single best fitting plan for your needs. Our advisors are actually blinded as to which plans chapter earns revenue from and which ones we don't. So the only consideration for the chapter advisor that you work with are the 3 Ps: your providers, your prescriptions, and your priorities.
Okay. And full disclosure, so if you call chapter now or in October, November, and they help you change your plan, then just like every other health insurance broker agent in the country, the insurance company gives them a commission. And it doesn't matter which health insurance company, they're pretty much all the same. Whatever one is best for you, that's one thing. And then if you use that number to call, then chapter supports all of the website and our new platform that regular viewers know that is going to be game changing. I would argue. I'd say it's going to be a game changer. So all of that money goes into support, but don't let's keep that between you and Ari and chapter, because if insurance companies find out we're doing something good for people, they might get angry.
Well, one thing that might surprise your viewers is that the majority of Medicare Part D plans are now non-commissionable. So someone might be wondering, hey, why did that Medicare supplement insurance company I work with, why did they sign me up for a Medicare supplement plan and then they didn't help me shop my Part D plan? That will never happen at Chapter. We will help you find the optimal Part D plan for you. And then we're going to do it every year because we know we can help you unlock further savings by reviewing your plan. What if your prescriptions change? Well, then it's important to reshop it. What if your pharmacy preferences change? What if the plans themselves change? There was a big change, as Dr. Ed mentioned, for this year with the establishment of the maximum out-of-pocket on Medicare Part D. So that ongoing relationship never ends here at Chapter.
Perfect. That's why my son and I chose y'all to help out our audience, help out our community, because you've got that. You completely, the people that they talk to are completely neutral. It doesn't care. They don't care which company you finally choose. They just give you all your options, and then you choose the best one for you. And the other reason is that the customer success team. There's a lot of people, and I love independent agents out there. If you've got a brother or son or cousin or niece or nephew or something like that that's a Medicare insurance agent, then you usually have to go with them if you trust them. But a lot of those independent agents just don't have the knowledge or time to help you through an appeals process and all the other kind of stuff, and finding a doctor and fighting this and fighting that and learning about your bells and whistles. So that's another reason we chose Chapter, because they have a dedicated team to help you out there. So it's all about
That's
customer
right.
service.
There are so many well-intentioned agents in the Medicare space. So
Absolutely.
let me start by saying that. If you go to a Ford dealership, though, what are you walking off the lot with? So it's a question of what tools does this local broker, your family, friend, whatever, what do they have at their disposal in order to use? You know from being part of this community that there's hundreds of insurance companies offering thousands of plans, and the rules vary plan by plan, zip code by zip code across the United States.
Yeah.
So it helps to have 2 separate teams that you're working with, your advisor and then your member advocate. So it's not a one and done relationship, it's ongoing, and we can make sure that you're getting the most out of your plan and hopefully help you find savings.
Exactly. And yeah, everybody that's reached out to Chapter has come in there and given comments during the live Q&A and on the comment section of my YouTube, and they all just love you. So we send those awesome comments to Ari and his team over there, and they share them with the entire company, the entire staff over there. So that's awesome. Time travel. Oh, time travel is back from the future, past. I don't like Medicare Advantage because all the annoying commercial. Oh, I hate those commercials. Yeah, the football players and starship captains and comedians and all that. Have those? I think those have kind of reduced over the last year or so, right?
There were changes that were forced to the Joe Namath ad, if that's what you're referring to. You could pick your favorite Medicare Advantage spokesperson, William Shatner, Jimmy Walker. Again, these are all blasts from the past celebrities.
Yep.
Still, the question, what is the question, Dr. Ed?
So, yeah, so the It was really bad a few years ago, all these commercials, and they would use the Medicare logo. And number one, you can't use the Medicare logo anymore, right?
Mhm.
So because people were thinking when they were calling this number, they were calling Medicare, but no, they were calling, a private company, which is
Right,
fine, but
right.
you can't be tricked into thinking you're calling Medicare. And the big thing that really gets me is these grocery cards, the over the counter cards. They do exist. People ask me all the time, do those? I saw it on Facebook, $100 a month and $200 a month or something like that. Do they exist? Yes, they do exist. But the scammy way they advertise those, they would pick the best one in the country that's only available in one zip code, and they would advertise it to the entire country. And then when you call them, they say, well, do you live in Paris, Texas? No, I don't live in Paris, Texas. Well, sorry, not available to you. And then they give you the hard sell, and they've got your information, and they sell it. It was just yeah, it really really torqued me off. You could tell I get a little perturbed every time I talk about it.
Yeah, there were limitations placed on how Advantage insurers and third-party lead generators can talk about those types of goodies.
Let's see. Joe didn't get a letter about Advantage Plan, but Braven in New Jersey has an app that tracks all of the extra benefits. They also have meetings every month to go over these benefits. So awesome. So there's local places. The chapter also has an app on getting these different resources as well, right?
Yeah, it's the Chapter OTC app, and you can download it on your iPhone or Android, and it will help show you your benefit utilization and see if there's more benefits than that you can obtain through your plan. And
Perfect.
more importantly, you can actually order the items then straight from the comfort of your couch, and they show up at your door. Sound
Oh,
familiar?
yeah. Perfect.
Right now,
Perfect.
it's
What is?
Prime Day, so
Yeah. Oh, that's right.
get,
That's it, isn't it?
get all
Yes,
your
that's right.
OTC goodies.
What does it cost to become a chapter member? Free, right? Zero.
Zero. It is
Zero.
illegal for agents to charge you. So if someone is charging you, that is illegal.
Yep. Let's see here. Let's see. True, but he has worked with insurance companies when having problems with doing. Okay, looks like someone's having some other. If we are having side conversations, which we love, that's why we're the best community on the internet. If we are on dual plan Medicare and Medicaid, will chapter still help us?
Of course. There's a special subset of plans called dual special needs plans, and they coordinate benefits between Medicare and Medicaid. So if you're on both, you would be eligible for that type of Medicare Advantage plan, dual special need plan, if it's available in your area. And then it's a question of your 3Ps, because guess what? If that plan won't accept one of your providers, no chance we're putting you on it unless you're willing to switch to a different provider.
Right. And for the dual advantage plans, those dual special needs plans, before there's been a change that you can only change every quarter. When can you switch your plan if you're on a dual special, the dual advantage? If you're on Medicare and Medicaid and have with the Medicare Advantage dual eligible plan, and then you're not happy with it, when can you change?
It depends if you've already changed it for this year. One switching period is the Medicare Advantage open enrollment period. That ended March 31st. If you've changed your plan as of April or later, then you might have already used your switching opportunity if you have Medicare and Medicaid. But there are certain types of plans that you can switch into once per month.
Okay, so if yeah, the whole thing is complicated and there's disaster things and they were going to change
That's
the
a
rule on that
separate,
one and they
yeah.
changed it, and there's if you move, if you lose your Medicare Advantage plan, you might be able to switch to a Medicare supplement plan if the company is actually closing down. And yeah, the keep an eye on special enrollment periods and initial enrollment periods and general enrollment periods is just it's a
Yeah,
nightmare.
but someone asked, they're 64 and a half, and they asked when they should reach out for Medicare guidance. Now would be a great time. You're going to receive so many unsolicited phone calls, direct mailers, and text messages. You're going to be bombarded.
Yeah.
So if you just want to know what you need to know in order to prepare to get your red, white, and blue Medicare card, and the guidance that you need to be positioned to start Medicare at 65, 6 months before is a great time to reach out to us.
Yep. And if you're tired of all those phone calls, I always say, just call Chapter and say, hey, put me on the list. Call me in October, November when the new plans come out. And that way, if you get a phone call in the future, you can say, I'm already have an appointment. Click. So.
Right. We cannot call you. So if someone puts their numbers in the comments, that's not permission to contact you. You need to
Exactly.
affirmatively give us permission, or you need to call us.
Yep. That's another reason we chose Chapter. My son and I picked Chapter is because, there's people aren't doing the right thing out there. If people don't know, my regular viewers know, but if you send me an email and say, hey, Ed, tell Ari and his team to call me, I can't do it. Can't do it. You have to call Chapter Ari and his team directly. I can't tell them to call you. You have to actually call them, contact them, go onto the website or whatever the case may be. So Diane says, so far, I am happy with my Medicare Advantage plan. It is no cheap, but does cover what I need with no problem.
That's great.
Yeah. But
I would just
how
review it
long?
in the fall then.
Exactly. Because your Medicare Advantage plan is only good until December 31st, right?
That's right. That's right. And Dr. Dr. Oz, different doctor, mentioned this in his testimony when he was being interviewed for the job by Congress. And they're looking at whether to increase the duration of these Medicare Advantage periods so that it's not just January to December. It's not just the calendar year. They're looking at perhaps lengthening the period in which your Medicare Advantage plan applies, maybe over 2 or 3 year period. We'll see how that shakes out. I haven't seen any regulations promulgated about actually changing the duration. So for now, it is a calendar year contract if you're on a Medicare Advantage plan. And that's why it's so important to review your plan during the annual enrollment period in the fall.
Exactly. Yeah, there's so much changing. So many changes. You guys are phenomenal. How much you could do making sensitive mess. Thank you so much for both of you, all the people to help you. Oh, awesome. Thank you for that. So somebody keeps asking, how much does it cost to be a member? It doesn't cost anything. All right. I prefer to use a local insurance broker to help me with my Medigap plan. Okay, perfect. Yeah, if you got someone you know and trust, absolutely. And with the Medigap plan, how do you put that, Ari? You marry a Medicare supplement, but you date a prescription drug?
That's right. The Medicare supplement plan that you first sign up for when you start Medicare, that is when you turn 65, or if you're past age 65 and coming off work-provided coverage, that's probably the plan that you're going to have for the long haul. So you're making a 30 to 35 year purchasing decision because that's how long actuarial tables suggest you'll live. If someone's turning 65 today, they have a 50-50 shot at living to 100. So it's really important to make sure that you're choosing the optimal plan, which just isn't a question of the price you pay today. It's a question, the way we price it here at Chapter, we look at your 20-year sum of premium index. So we take your age today, we add 5 years, 10 years, 15 years, 20 years, sum those premiums together in order to give you a benchmark as to compare the different Medicare supplement plan letter offerings. Because Plan G has the same hospital and medical benefits, but the prices vary enormously. The same is true of Plan N and Plan F. Those are the 3 most common Medicare supplement plan letter types. So we want to make sure that you're making a really good purchasing decision for the long haul.
Perfect. So let's see. The Imaginator went through Chapter. They helped you with a plan, paid $141 for 3 months of Xarelto. Without insurance, it will cost $21.53. It's crazy, the price. I would be interested in that. You mentioned that, was it someone in Oregon had a muscular dystrophy, $100,000. I'm interested in how much, that particular drug would be like in Canada or Europe or something like that. So, but drug prices are just
It would be
outrageous.
incredibly more expensive than if they didn't obtain a formulary exception.
Yeah.
As for
crazy.
this question from the Imaginator, it's great. It sounds like your plan is doing its job, that it knocked the price down to $141 over 3 months. That's a great example of the Medicare Part D program working as it should.
Perfect. Let's see. What is the difference between Medigap and Medicaid? Medicaid. I'm 69 and no meds and have low income Medicaid with the extra help Slimby. You wanna go for that one?
It's illegal for you to purchase a Medigap plan, and it's illegal for someone to sell you a Medigap plan. So you are not eligible for a Medigap plan because you have Medicaid. So you should not be on a Medicare supplement plan. Instead, Medicaid is responsible for your co-payments and your co-insurance above and beyond what Medicare covers.
You can get a Medicare Advantage plan though, right? But just not a Medicare supplement, a Medigap plan.
Correct.
All right. So it's basically because it's the Medicare supplement. The health insurance companies would love to sell you a Medicare supplement plan, and charge you $100 a month or something, and then not have to pay anything because Medicaid and Medicare covers everything. So that's would be kind of like free money for the Medicare supplement plans if they were able to do something like that, right?
It would be. It's so distasteful that it
Yep.
really makes my head spin, though.
Yeah.
And
Yeah.
really, when someone gets Medicaid, in the rare case in which someone on a Medicare supplement plan obtains Medicaid, we absolutely help you cancel your Medicare supplement plan so you aren't double paying.
Perfect. Yes, absolutely. Good. My sister has an Advantage plan and she loves the cost, but had been denied things that wouldn't have been a problem using Medicare. She chose it due to cost and it works for her. Yeah, that's why 51% of people choose a Medicare Advantage plan is because of, the cost and the extra benefits. And a lot of the times because they just don't know the difference between a Medicare Advantage and a Medicare Supplement, Medigap plan.
And let me just say here that there are trade-offs with Medicare Advantage. It sounds like in this case, to Kathy's question, the trade-offs are worth it for your sister to be on the Advantage plan. And that's exactly the point. With Medicare Advantage, you have to consider the trade-offs. It's about your 3Ps, and then you can get into the question of the additional goodies. Now, if you have a lot of hospital and medical costs, you're probably going to do better on a Medicare supplement plan if you can afford it. And that's the big if. So we want to walk you through the math and show you what your out of pocket would be, how many dollars would go out the door if you're on the Advantage plan based on your hospital and medical needs versus a Medicare supplement plan.
So Carrie says, I have a Medicare Plan N starting October 1st. I had so much stress from my Medicare Advantage plan, I switched to original Medicare on January 1st. Dr. Weir says, don't do this. I am in a good shape. No, I always recommend Medicare supplement plans, a Plan N or a Plan G, if it's in your budget. If it's not in your budget, then it's not in your budget. But if it's in your budget and you've got a Medicare supplement plan N or G and you're paying the right price for it, keep it as humanly long as you possibly can. But if one day you just can't, swing the $185 plus the monthly premium for the Part D prescription drug plan, plus the Medigap plan N or G, the monthly premium. And remember, you don't get the vision, dental, or hearing with any of that, so you might have to do that separately. But if keep it as long as you can. But if not, one day, then Medicare Advantage is infinitely better than just having Medicare Part A and Part B alone, because there's just, unless you've got a few $1,000,000 sitting under your mattress somewhere.
Yes. And with Medicare Advantage, you still owe the standard Part B premium of $185 per month. So even though most Medicare Advantage plans have a $0 premium, you still owe the standard Part B premium unless you qualify for a high enough level of Medicaid to pay for your Part B premium.
So let's see. That's why I picked a Advantage PPO this year. All my doctors are still in the regular Advantage plans too. I still wanted PPO. Not sure next year could change. I've heard some rumbling about they're going to possibly, because of the cuts, they're talking about reducing PPOs, but we don't know what's going to happen until it happens. So PPOs versus HMOs.
Yeah, let's talk about that. So under a Medicare Advantage plan, you are subject to network restrictions. Those network restrictions can take different flavors. The two most common, an HMO, which means you're limited to seeing doctors that are in network. And the second most common is a PPO, which means that you can go out of network for coverage as long as your provider accepts the terms and conditions of your plan. And that's where the rubber meets the road. And that's something our member advocate team spends so much time on, is double checking when someone is on a Medicare Advantage PPO plan that they can go to that out of network provider and they accept your plan's terms and conditions. So that way it's subject to the plan's copays or co-insurance for that PPO visit. Otherwise, you're paying 100% out of pocket at the time of visit.
Yeah. My chapter experience has left me wanting. I was told my condition would need an underwriting process. So what? I still want to get a cheaper policy if I can, Yeah, so if you're outside of your initial enrollment period for your Medicare supplement, the Medigap plan, same thing, then yeah, you have to go through underwriting, and underwriting usually is painless. Ari and his team just ask you about 20 or 30 different questions that the company that you chose. So if you choose this particular company, they have a set of questions. They'll ask you, have you had a heart attack in this long? Are you waiting for any surgery and stuff like that? If you answer no to all of them, then it's good. If you answer yes to some of those questions, depending on the company, chapter knows which companies are, good on this and more strict on this other thing. But if you've got some type of condition, yeah, then it's going to be possibly difficult depending on that condition, right?
Yeah, and it sounds like we could have done a better job explaining the why here. In 46 states, if you're more than 6 months away from having started Medicare Part B, that is, if more than 6 months have passed, then in 46 states, you are likely subject to an insurance company's underwriting questions. That is, they get to ask questions about your recent health history if you want a Medicare supplement plan. There is an exception here if you have a guaranteed issue right, and you would have a guaranteed issue right, for example, if your plan kicks you off. If your Medicare Advantage plan kicks you off, you get to switch to a Medicare supplement plan with no questions asked. It's a great opportunity if you're being kicked off your Medicare Advantage plan. But it sounds like you live in one of those 46 states and you were subject to an insurance company's questions about your recent health history, and we weren't able to find you a plan that would accept you for insurance, which just means that when the fall rolls around, it's an opportunity to shop your Medicare Advantage plan and for us to find you something that will provide better coverage for the upcoming year.
And if, because this last year that happened quite a bit, a lot of Medicare Advantage plans decided to pull out of particular areas. One company left the entire state of Missouri, and then you get a special enrollment period. You keep that letter, and the bottom of the letter says, yeah, we're abandoning you by, but because we are, you have a special right to get a Medicare supplement plan, right?
Yes, that letter is a golden ticket, and it allows you a guaranteed issue right to purchase a Medicare supplement plan. No questions asked about your recent health history. Now, you might be wondering, Ari, you said 46 states. What are the 4 states that are the exception? New York, Connecticut, Maine, and Massachusetts. So those 4 states along the North Atlantic seaboard are guaranteed issue states, meaning that you can sign up for a Medicare supplement plan without answering questions about your recent health history.
Perfect. And does chapter work in all 50 states?
Yes, including the District of Columbia.
All right. All right. So, Jared, call chapter and move from an Advantage plan to a Medicare supplement plan. Keith was amazing and thoughtful. Need to call them back and make sure I am on the right track. All right, Keith.
Keith,
you got a great team
we're gonna
there.
snippet this and post it in the team chat.
All right, good deal.
Keith
Good deal.
gets his proper due.
Yeah, there you go. Yeah, I think I've gotten a lot of good response from Keith. I remember that name. So yeah, y'all are staffing up because 2026 is going to be interesting, and y'all spend a lot of time finding the best people. And whatever you're doing, finding these people, you're doing a phenomenal job because people, anytime they contact me, email me, or come in here, they said this person, Keith or whoever it was, spent an hour, 2 hours, and they explained everything, and they couldn't be more happy. So thank you, Ari, for taking care of our people. We really do appreciate it.
I will certainly pass this along to the team. We only hire the best of the best, and then we train them to make sure that they're ready to serve your viewers. And we spend so
Perfect.
much time on training, and that's what we're going through right now to make sure that we're prepared for the fall.
All right, good deal. All right, Ari. Hey, thanks again for joining us. We sure do appreciate it, and we'll have you back again sooner rather than later. How's that sound?
Sounds great.
Okay, thank you, everybody, and I will be back again tomorrow with some other topic, and then if I didn't get your questions today, make sure you come back tomorrow. And remember, if you submitted a video question, I don't know if you know, Ari, I'm doing a new thing on the bottom left of, you can't see it with my name getting in the way there, but if you go onto my website, mygovexpert.com, and you go to any page, and you'll see on the bottom left a little camera, a little question or comment there, and you click on that and you can ask a video question, and then I answer those within 24 hours. I didn't today because we had a different topic, but I've got some questions already lined up. I will answer those tomorrow, and then maybe we'll get Ari to answer some of those in the future. All right, Ari, we are sure to appreciate you. Take care of yourself.
Thank you so much, Dr. Ed.
All right, and everybody else out there, take care of yourself, and please, 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 please